More U.S. states and cities are going on lockdown to fight the spread of COVID-19. Virginia, Maryland and Washington, D.C. have all issued stay-at-home orders. The United States has the highest number of confirmed COVID-19 cases in the world right now, with more than 163,000 confirmed cases. And the death toll has also passed the 3,000 mark. President Donald Trump has extended the nationwide safe distancing guidelines until the end of April. He'd initially indicated that he wanted things to, quote, get back to normal by mid-April, but now he's warning restrictions may be tightened further.
We may add a few more, but the guidelines will be very much as they are, maybe even toughened up a little bit. But they're having a big impact. They're having a tremendous impact, and we're starting to see it.
At the same time, warehouse, delivery and retail workers across the U.S. have gone on strike to call attention to safety and wage concerns during this health crisis. Workers at U.S. online grocery deliverer Instacart and retail giant Amazon, they've all staged walkouts. Now, they say companies aren't doing enough to protect them and are demanding better safety precautions, hazard pay, as well as paid sick leave. For more, Simon Marks is in Washington, D.C. for us. Simon, President Trump says that the next 30 days could be vital for the U.S., and he's hinting at some tougher federal measures. What could that look like?
Well, what it could look like is moving beyond what are currently simply guidelines that the White House has put out and issuing much stronger advice, possibly even mandating it legally. Now, the big problem here in the United States is that there is a debate about just how much power the President of the United States has to order, for example, the nationwide lockdown that behind the scenes for weeks now his public health officials have been urging. But at least one of those officials, Dr. Deborah Birx, who heads the President's coronavirus task force, took to the airwaves here on television yesterday and insisted that unless cities and rural areas across the United States that have not been taking coronavirus sufficiently seriously toughened up their restrictions, she did not believe that a death toll of 200,000 people would be attainable for the United States, that the death toll would rise much higher than that, which is one of the reasons why you saw Washington, D.C., Virginia and Maryland cracking down in the last 24 hours. In Maryland, the governor says he is concerned that his state could soon become an epicenter for coronavirus. He says the curve of infections there is moving much steeper than the curve of infections was in New York just a couple of weeks ago. But President Trump has a big decision to make. Is he going to risk the ire of those Republicans who philosophically believe the national government shouldn't be playing a role here, that it should all be falling to the individual governors of individual states, which is why you have this huge pattern of disparity between the lockdown here, for example, in Washington. I could be fined $5,000 for breaching the rules of that lockdown today, and the situation in states like Florida and Texas where similar measures have not been imposed. Will the federal government now start playing a role in encouraging states to do that? That's a question that is on President Trump's desk today.
Simon, what is the Trump administration doing to address the severe and growing, it seems, shortage of medical equipment?
Well, I think the first point to make, Steve, is that the Trump administration does not accept the argument that there is a severe and growing shortage of medical equipment. And President Trump was in the Rose Garden of the White House briefing reporters last night, surrounded for the second day running by leading corporate executives from industries all over the country. He invited them all to the microphone to explain what they are doing to contribute to the national effort. And he spoke about hundreds of tons of equipment being ordered and delivered. So the White House doesn't accept the premise of that question, even though, of course, that question is being fueled by testament from healthcare professionals, doctors, nurses all over the country. So the Trump administration says, look, we are doing everything we can to get equipment now into the hands of hospitals, doctors and nurses, even as the governor of New York, Andrew Cuomo, says he finds himself now in a pricing competition as he bids and other states counterbid on price to try and acquire, for example, the ventilators that he says he needs. So the true picture here remains very opaque.
Okay, many thanks for that update. Simon Marks bringing us the latest from Washington, D.C.